Well, for 25 years I was in the practice of general surgery, and as a surgeon I made wounds. And after 25 years I decided to switch completely, and now I'm in the field of wound care. And so my role now is to try to facilitate the healing of wounds as quickly as possible. Well, I think one day Eric showed up at the office with some brownies, and he does make very good brownies. And he knows that we treat a large volume of patients with swelling or edema of the lower extremities, and that the lymphedema pumps that he sells would certainly assist in the healing of these wounds. I've seen the product firsthand. I opened up a lymphedema program at the hospital, and I'm proud to say we're one of the few facilities where inpatients can be offered this form of therapy. And so I actually do place the devices on patients myself in the hospital, so I see firsthand. And it gives me a better understanding of the mechanics of the device and how it works in certain individuals. I think if you choose the right individual and if they're compliant in using the machines, the results are much better. The outcomes are much better. Wounds tend to heal, and wound healing is only the first priority. The second and third priority is keeping patients free of wounds and keeping them out of the hospital. There's no question that with a comprehensive form of treatment where you focus on the wounds, focus on lifestyle changes, and assist the patients with these pumps, that their wounds do heal quicker. Because generally on the inpatient side, the service is not reimbursable, and therefore facilities generally don't use it. But I've been able to provide this service to the patients at no cost, and it bridges the gap between being in the hospital and then going home and having the same level of care. The billing aspect for these pumps is very complicated. Oftentimes there is delayed gratification from the standpoint of medical solutions getting paid, and they have gone to bat for the patient all the time, making sure that they have the equipment, providing loaner equipment until the insurance company pre-authorizes it, and that's what makes Medical Solutions very special. Well, I think the first thing is the patients need to go to a wound care provider that's knowledgeable in lymphedema therapy. Second, they need to have the equipment supplied by a vendor who stands behind their product, stands behind the service. And thirdly, they have to be willing to contribute their own time and make their own sacrifices and be compliant. And when you have all those elements coming together, the therapy works. I see quite often that patients will come to me through other sources with the lymphedema pumps already provided. And quite often the scenario is the pump arrived, we had to take it out of the box, read the instructions, set it up. We really never knew exactly what we were doing. There was no one to call, there was no follow-up, and most of the time that equipment falls by the wayside, it's not used, and it's a waste of not only their time but money. That does not exist with Medical Solutions. They'll make sure the equipment is arrived, they'll send someone out to unpack it, package it, they'll in-service the patient, and they've always been available to me no matter how long the patient has had the pump, to go out to look at the pump, make sure it's functioning, or even work with me to upgrade the pump at some point in time.